But without further ado then, I really wanted to introduce our second speaker, Dr. Faraz Mughal. And Faraz is a GP and a National Institute for Health Research in Practice Fellow at Keele University. And Faraz's research is really relevant, and it focuses on young people's mental health in primary care and self-harm in particular. So really pleased to have Faraz joining us today. If you can share your screen, Faraz, that would be brilliant.
So as said, I'll be talking about supporting young people who self-harm. And my background is I'm a researcher supported by NIHR and also a GP in the NHS. And I'll be covering some areas that are applicable to a number of different groups. So those families that struggle with self-harm in the family, those people that work with self-harm maybe in the health service and outside of the health service, and young people also who may be joining us today. So firstly, seeking help. I wanted to start off with, what does the research tell us around young people seeking help? As said by Anne, it's really important that young people are encouraged to seek help. Self-harm, from my work as a GP, but also from my research work and speaking to and interviewing young people who struggle with self-harm, it's extremely clear that it's a very challenging topic to talk about. And in terms of what helps young people to seek help, firstly and foremost, they relay that they want to be treated with respect. And this cottons on to a few of Anne's points earlier. But really it's something that people can bear in mind if self-harm is within the household. And more so, I'm sure that people who work with young people who self-harm in their professional work, this is something that's one of the guiding principles of their work. Secondly, young people feel more at ease if they can talk to someone that they trust. So this is around building trusting relationships. And if people haven't got this at present, then it's an opportunity, if they're spending more time with the young person who's struggling with self-harm, it's an opportunity, given the current situation and context of COVID, to try to nurture that trust, just through simple things in the house or on the telephone or remotely. And finally, the research tells us that young people want reassurance and assurance around confidentiality. And this is not only talking about in the healthcare consultation with someone clinically, but also with their friends, peers, and within the family too. A very common scenario is that a young person is very happy to talk about self-harm with one person in the family, but does not want another person who could be very close to them to find out about it. Could be a sibling or a different parent. So please do bear that in mind. In terms of things that hinder young people seeking help, unfortunately, the stigma around self-harm is still present. And I agree with Anne that I feel it's improving, and this may be reflected in more young people seeking help. And in the research that Anne leads, we see the presentations of self-harm to clinical services increasing, which could be a good thing. So young people have the opportunity to try to get more help. Secondly, again, confidentiality. They're concerned that they don't want their confidentiality to be broken. And one of the most important things, and Anne touched upon this also, is the initial reaction to a young person disclosing or talking about self-harm. They really, they have said in the research that negative reactions really hinder them in seeking help for self-harm. But generally, young people turn to informal supports more than formal healthcare support. So this highlights the important place that families, parents, carers have in trying to support young people who self-harm. So the research also tells us, highlights that the well-being of carers, parents and families can be severely affected if their young ones are struggling with self-harm. And in terms of the needs of families, parents and carers, this is broken down into two main areas. Firstly, support, and secondly, information. So when thinking about supporting parents and carers, the first thing that comes up in the evidence is that they really want a system-wide approach, which would involve and encompass a joined-up approach in the healthcare system, primarily, which is something that I think everyone in this field is working towards. But a brief example would be improved communication between the GP practice of the young person that the family can usually go to first, and the mental health services, for example. Secondly, they really want to be able to feel listened to by people that parents speak to and reach out for help. Thirdly, they want to be able to get some advice about how to look after them, and also how parents and carers and families can seek help. And shortly, I'll be touching upon some useful resources that are evidence informed that may be useful for parents and families to look at. They really find social and peer support to be really important. It's always useful to talk to other people who have gone through similar experiences, and this is really important with families. And if you know someone, or it may be an idea to reach out to close friends, just to share your concerns, and you never know, you might find out that other people are going through similar situations too. And finally, parents and carers have said that they want to learn new skills to improve relationships and communication within the family and with their young people. So in terms of the second area of need for families, parents and carers, they highlight the importance of information. So this includes helpful strategies and treatment options that they can perhaps talk about and share with young people, practical advice, and also a diversity in information sources, and we'll touch upon this shortly. So moving from parents, carers and families to what do young people, what are they after? What were they like? Young people who struggle with self-harm. Firstly, again, just to emphasize, it's quite an easy thing to do. It's very slip of the tongue, or something that shocks you if you weren't expecting a young person that you may know or work with to disclose self-harm. But do really try to take a minute to try and pause and think about a useful response to give back to the young person, because often young people do say and tell us that it's the first response to help seeking that's really important for them. If it's a bad experience for the young person, then that really does affect future help seeking. So trying to have an open conversation as best as possible in the current circumstances is something that we should try to implement. Secondly, young people say that they want support in accessing services, both formally and informally. So not only those in the NHS, for example, but those really important services that fall outside of the NHS, such as community services, self-harm charities, support work, and the list can go on. They again want to be spoken to with respect and have their privacy maintained, and this falls under certain boundaries. And of course, now sticking and adhering to boundary and climate where the majority of people are in limited, restricted areas is hard. But maybe thinking about ways to try to maintain that can be useful. And finally, but maybe equally as important as all of the other points, young people say that from their families, parents and carers, they want time, attention, support and care. And this coronavirus pandemic global issue at this present time, impacting on so many people's lives. However, one positive that may come out of it, for the people that haven't been affected by the illness, is the opportunity to have time, dedicated time in the family as best as possible, maybe a lot more than they wouldn't have in the past. That could be something to think about, to try to make use of the time with young people, building those relationships and trying to build that trusting relationship. So now moving on to what can GPs do. This is around my own personal practice and what I know about general practice and GPs and self-harm. Also, it can be transferable and applicable to other clinicians outside of general practice and therapists and people that generally see young people face to face or one to one, now remotely. And it does also apply to remote consultations, either video or telephone call. I've chosen 5 key things here, and these are evidence informed generally. Firstly, again, can't emphasize this enough, those open, non-judgmental questions are really important for those people in a trusting position, for example, if they're in the healthcare system, to really allow the young person to open up and allow them to talk a little bit about their self-harm, to understand the context of self-harm. A lot of us in our professional work, especially in the NHS, are pushed and pressured on time, but it's something to just bear in mind that the self-harm is the most serious risk for death by suicide. So even if we are running very late or we're inundated with lots of requests in our work environment, just to try and give young people a little bit more time where possible. Secondly, I did a bit of research recently looking at all the global evidence, and I found that the involvement of parents and carers and families can help the GP consultation with a young person who struggles with self-harm. So think about involving them where applicable and where consent is being given by the young person. Follow-up is another really important area. Clinical guidelines for general practice touch on this very briefly. And I know people practice in different ways, but it only takes a few moments just to think about dropping a young person a brief telephone call, maybe 1 to 2 weeks after they've talked to you about self-harm. And again, it's about validating the self-harm, and also about realizing that yes, self-harm can come and go in terms of self-harm behavior, but we still unfortunately have a lot of young people who repeat self-harm. And in general practice, 1 in 5 young people in the year after they see their GP would unfortunately self-harm again. So thinking about the environment, everyone's environment is going to be very, very, very different at this moment in time. But it's important to ask about what the environment like is for that young person at that time of speaking to them, and think about if there are any concerns for their mental health and physical health in that environment, and therefore safeguarding is a really important area to think about and to explore with that young person. And also, people speaking to young people in a professional in the professional work need to be aware of what services are available in their locality, also online services, and there isn't an exhaustive list of self-harm online services, but we'll touch upon a few of them shortly. So last few slides now. Some practical suggestions during this very difficult time. And I'm sure a lot of these points, these 5 points, are not new for the majority of people here, but it's always useful just to recap, and they may serve as useful reminders for all of us. Firstly, when a young person is feeling distressed, upset, and we know that significant psychological distress is a significant precursor to self-harm. It's important to discuss with the young person, or if you're the young person yourself, try to find distraction techniques. Now, you may have explored all of them at home. You may have run out of anything new. This might be the time then to maybe speak to people and try to find new ways to try to cope with thoughts and feelings. Secondly, trying to engage your family members, and everyone's now using more virtual engagement, and that's something to try to bear in mind. Routine can help well-being and emotional health, and that's something across all mental health problems. But we do know there's a little bit of work around sleep, and sleeping poorly can affect self-harm thoughts and suicidal thoughts. So trying to establish a good routine in the day can help with that. For parents, carers and families looking after people who self-harm, think about ways to look after yourself also. It can be a very distressing time. It can be draining, and it can impact the burden can be quite heavy on people who engage with young people and try to support them. And self-help ideas, such as there are a lot of apps out there. I'm not sure, I don't think any of them which are freely available are informed and have been evaluated through research, but they may still be useful to refer to. There are several fantastic self-harm charities across the country, Harmless being one of them, charities around the Bristol area, and then if you've tried those resources and those options, then it's always important to reach out to your GP, who is your first port of call, and one-on-one services if the GP practice is unavailable. In terms of young people who feel like they've gathered enough, they've got the courage now to talk about self-harm, a useful tip that I've come across in the past is to try to maybe write down what you want to say to someone, whether that's someone in the family or someone in the healthcare service. If you find it difficult verbalizing it, then maybe writing it down, email or paper, something similar, that may help also. So in terms of support services, the website called Kooth, and that's available across different CCGs, which for people that aren't aware of that term, it's the clinical commissioning group that fund the majority of NHS services in that area. I guess the first thing to do is just to put it into Google and try to see if you can access it free of charge. Also, people's GPs can give them access if they've got the funding to do so. Everyone generally has heard about Samaritans, but that can be accessed telephone or over email. Young Minds have really good resources on self-harm that people can read, not only for young people but for parents, carers and families. Harmless is just one self-harm charity that I'm aware of. I'm sure there are lots more who may be able to support families and also young people too. And Childline, lastly. the image of the Coping with Self-Harm, a guide for parents and carers. This is a fantastic guide. I saw a few questions earlier about what resources there are for families, parents and carers. And this guide is evidence informed from a large research project that interviewed several parents, carers and family members of young people. So it's really worth having a look at that, and just typing that guide into Google will get the link from Oxford University. So I hope that's been useful, and that's the end from me.
Thank you very much for joining us for this recording from one of our Emerging Minds webinars focused on how we can best support children and young people during this time of COVID-19 and what research can offer us. We are planning a range of webinars and you can find details of those on our website. And please do also get in touch to let us know what subjects are on your mind and what you'd like to focus on next. So a quick word about Emerging Minds. We're a research network funded by UK Research and Innovation, and members come from all sorts of disciplines and sectors, but we're all working towards reducing the prevalence of mental health problems experienced by children and young people. We really invite you to get involved, so please do sign up to keep in touch with our newsletter via our website, or keep in touch on social media, for example, Twitter. We also wanted to talk to you about a survey we are running at the moment called CoSpace. So we want to learn how families are coping with the challenges of COVID-19. So if you're a parent or a carer of a child in the school years from 0, so reception and foundation, to 11 in the UK, please do consider taking part. And your responses will really help us to find out how children, young people and their families are getting on, what's working for them, and how we can best help. Please do also spread the word to your networks and colleagues too. You can see there some of the findings that we've shared so far from the study, and on our website you can find resources particularly for parents and carers and people that work with children and young people, like the one here on the screen about supporting children and young people with their worries. Thanks again for listening, and we hope to keep in touch with you. All the best.